Like most things health related, it's more complicated than a single answer. I know that's probably not what you want to hear. Most people are looking for the silver bullet, the pill, the one thing that will alter the course of whatever problem they're trying to deal with. What I wanted to talk about today is in relation to hair loss. There are a lot of ways, mechanisms, tools, resources out there in regards to hair loss, and it just depends on how invested a person is in achieving a particular result. This is an informational presentation. I'm not telling you to do this, that this is safe in your particular situation. Obviously, there are a variety of scalp conditions and underlying medical problems that can cause some issues with trying different techniques. So always consult your particular practitioner, provider, your local expert, boots on the ground person, and get their input as well. Microneedling is something that is commonly done. A lot of my patients do it for a variety of reasons with varied results. Some do it on their own at home, others seek professional help and have it done in a hair loss studio, if you will. And the way this works is on something called the dermal papilla. You can think of this as just a barrier between the different layers of the skin from the outside into the subcutaneous layers. Well, what's the big deal? Why does it matter? The dermal papilla is basically a milieu, a physical and chemical structure that houses epithelial progenitor cells, basically stem cells. Many of you have heard of stem cells. We use them for a variety of things. They are at times used for joint pains, cartilage issues, sports injuries, a variety of things. The mechanism that the microneedling works is to help regenerate and stimulate this particular part of the skin or scalp, if you will. We know that in people who have a lower number of DP cells, the hair follicles are smaller, they regenerate less frequently, they have progressive thinning and overall hair loss. So the theory behind microneedling is by stimulating these progenitor cells, it can help increase the health, the vitality of the hair follicle itself. And the variety of tools out there available. I'm just going to show you one, and many of you who are not familiar with this may think of this as something that's barbaric or extremely painful. I've seen a variety of needle mechanisms out there. There are actually some automated or automatic devices out there that will do this, as well as just simple roller devices, which I'm depicting here. You can see in the close-up video, these are small titanium needles. These need to be cleaned, this puncture into the tissue, and like anything, razor, toothbrush, things like that, these are not to be shared among individual people. It'll tell you that in the instructions and the fine print as well. The theory that many companies tout is that this actually cleans the scalp or removes debris. I'm not sure how well that really applies. There are a variety of skin conditions that can result in some inflammation or buildup of cells and plaque, if you will, that are problematic for hair loss as well. So there is a study out there that showed comparing minoxidil, which many of you are familiar with as topical Rogaine for the brand name, versus doing a micro roller technique along with minoxidil. And what they found in that study was that very few, only 4.5% compared to 82% of those who combined both a rolling technique and the topical minoxidil had actually a 50% visual improvement in the hair regrowth pattern. So that's I think there was like 1,200 or something like that people in the study. I'm going to include the link at the end if you want to learn more about this and see their data as well. There's the references for you. And as always, if you want more content like this, particularly in the realm of the men's health, which is what these videos are geared towards, I have a variety of other topics on my channel as well. As always, consult your local practitioner for expert advice and guidance for your unique situation. Health is not a one-size-fits-all, and having a custom-tailored, bespoke approach is always going to be the best answer. Take care. Be well.